Effect of adjunct yoga therapy in depressive disorders. Findings from a randomized controlled study. This was printed in the Indian Journal of Psychiatry, the official publication of the Indian Psychiatric Society, November to December 2019. Abstract. Background. Depression causes significant burden both to the individual and to society, and its treatment by antidepressants has various disadvantages. There is preliminary evidence that adds-on yoga therapy improves depression by impacting the neurotransmitters involved in the regulation of mood, motivation, and pleasure. Our study aimed to find the effect of adjunctive yoga therapy on outcome of depression and comorbid anxiety. Materials and methods. A randomized controlled study involving patients with major depressive disorder were allocated to two groups. One received standard therapy, antidepressants, and counseling, and the other received adjunct yoga therapy along with standard therapy. Ratings of depression and anxiety were done using the Montgomery-Åsberg Depression Rating Scale and Hospital Anxiety and Depression Scale at baseline, 10th and 30th day. Clinical Global Impression Scale was applied at baseline and 30th day to review the severity of illness and clinical improvement. Results. By the 30th day, individuals in the yoga group had significantly lower scores of depression, anxiety, and CGI scores in comparison to the control group. The individuals in the yoga group had a significant fall in depression scores and significant clinical improvement compared to the control group from baseline to 30th day and 10th to 30th day. In addition, the individuals in the yoga group had significant fall in anxiety scores from baseline to 10th day. Conclusion. Anxiety starts to improve with short-term yoga sessions, while long-term yoga therapy is likely to be beneficial in the treatment of depression. Introduction. Major depressive disorder, MDD, is a highly prevalent chronic and disabling disorder associated with a reduced social functioning, impaired quality of life, increased mortality, and is currently one of the leading causes of the global burden of disease. It is an estimated prevalence of 6% to 20% worldwide, with 20% in women and 12% in men during their lifetime, respectively. MDD is defined as a period of 2 weeks or longer in which the mood is predominantly low, sad, or at least 4 other symptoms involving changes in weight, appetite, sleep, activity level, energy, concentration, and suicidality. Most individuals with depressive disorders also have comorbid anxiety symptoms. The role of yoga in health aspects of an individual in the society is multidimensional, as suggested by the emerging evidence of the beneficial effects of yoga therapy in various physical and mental illnesses. Yoga is a practice that is spread across the world among various cultures and religions. Yoga involves 3 components: gentle stretching, breath control exercises, and meditation. The origin of yoga dated thousands of years back and was considered as one of the earliest and most effective methods for providing peace and tranquility of mind. Achievement of practices has been shown to have some beneficial changes in neurotransmitter systems such as serotonin, dopamine, and norepinephrine, The neuroendocrine system, the hypothalamic pituitary axis, changes in neuroplasticity, and the immune system. These systems are implicated in the pathophysiology of depression and the anxiety secondary to it. Thus, yoga may be useful adjunctive treatment for depression. There is a dearth of Indian literature, especially in terms of randomized controlled trials, showing the influence of yoga in reducing the severity of depression. Hence, we conducted a randomized controlled trial to find the effectiveness of adjunct yoga therapy in depressive disorders and its accompanied anxiety symptoms. Results. The mean age of the total sample was 38.19 years. The mean age in the yoga group was 36.9, and the control group was 39.48. The majority of patients in both the groups were married, belonging to lower and middle class, and hailing from rural areas. The majority of the patients in both the groups had MDD, followed by bipolar I disorder, current or most recent episode depressed, and at the least had MDD recurrent episode. Majority of the patients in both the groups were treatment naive. The result shows that there was no significant difference in age, gender, socioeconomic status, marital status, area of domicile, total duration of illness, episode number among the yoga and control groups. There is a statistically significant difference between the two groups regarding fall in MADRS and HADS depression subscale score on the 30th day, but not on the 10th day. However, there is a statistically significant difference between the two groups regarding the fall in the HADS anxiety score at both 10th day and 30th day, respectively. The improvement in the CGI scores at the 30th day were significantly higher in the yoga group than in the control group. Discussion. This is a longitudinal, observational, randomized study conducted in a tertiary care center to find the effect of adjunct yoga therapy in patients diagnosed with MDD, according to the DSM-5. The study by Naveen and others on antidepressant and cortisol effects of yoga divided individuals into 3 groups: yoga therapy, yoga along with antidepressants, and antidepressant alone, based on the patient preferences and not by randomization methods like in our study. The study on the effect of yoga therapy in individuals with MDD included a yoga group and a control group, which were non-randomized. They were also used the DSM-4 as the inclusion criteria for MDD, unlike our study, which uses DSM-5, a more revised and currently widely used version as a criteria for including patients with depressive disorders. In a randomized study on the influence of exercise and yoga in depression for 12 weeks, the MADRS was applied at the baseline and at the end of the study. The results showing a significant fall in the MADRS score at the 12th week in the yoga group were similar in comparison to our study, which also had a significant fall in depressive scores at the 30th day. Our study shows improvement after 30th day and not on the 10th day, which implies that adjunct yoga is required for a longer period for improvements of depressive symptoms, which is also similar to the study where a 12-week period had produced an improvement. This focuses on the fact that short-term yoga therapy may not help in alleviating depression and the necessity for a longer duration of yoga therapy in depressive disorders. Although the MADRS is widely used as a rating scale for depression, it was applied only in a limited amount of studies involving yoga and depression. We used both rating scale for depression, example the HADS and the MADRS, and this study brought out the concordance of MADRS scores with HADS. A cross-sectional study on the impact of yoga in depressive and anxiety scores in patients with chronic illness was conducted for 7 days and was rated by HADS-A and HADS-D at baseline and end of the study. The results showed that short sessions of yoga have caused a reduction in anxiety scores, while long-term yoga therapy was able to produce a reduction in depressive scores. Our findings correspond with this study results, which also had a reduction in anxiety scores at shorter sessions of yoga than the depressive scores, which required longer-term yoga therapy. This improvement in anxiety is noticed early, presumably because the practice of yoga is essentially targeted at calming the nerves and mind, which ultimately helps in stress reduction. It is also known for correcting and regulating imbalances of the autonomic nervous system associated with sympathetic hyperactivity. This may explain why yoga practices, even for shorter duration, may help in the reduction of anxiety. Meanwhile, in depression, due to the synaptic level changes, the reduction in the depression scores with adjunct yoga therapy may take a longer duration. Our study included individuals who were admitted as inpatients, which by a close observation was ensured and was provided bedside yoga sessions under the constant supervision of a certified yoga therapist. Patients who were discharged before the end of the study period were trained and emphasized to continue yoga sessions at home, which were periodically checked using personal log entries, along with mandatory 2 supervised yoga sessions in a week on an outpatient basis. This helped in ensuring a prospective follow-up study design. A randomized controlled study on Iyengar yoga and depression also had longer yoga sessions, 12 weeks, but the supervised yoga sessions were less, and the focus was more on home-based training. These non-supervised sessions in each studies might have the possibility of the individuals not conforming to the appropriate postures, techniques, resulting in reduced efficacy, and the adherence to the daily yoga practice was also not monitored during the follow-up. In this aspect, our study ensured increased adherence to yoga sessions during the study, and hence the results may be considered more reliable. The individuals receiving yoga sessions were not confined to a particular type of yoga and were personalized according to every subject based on their preferences, limitations, and also after careful assessment by the certified yoga therapist. Participants practiced a yoga therapy protocol that was specifically designed for patients of depression, keeping in mind their general health status and various physical limitations. This included simple warm-up and breath-body movement coordination practices, jathas and kriyas, static stretching postures, asanas, breathing techniques, pranayamas, and relaxation. The postures included Tala Asana, a vertical spinal stretch done from standing, Ardha Kati Chakra Asana, a lateral spinal stretch done from standing, and Kati Chakra Asana, torso twist to right and left, done in tune with the breathing rate of 6 to 8 per minute and 1 to 3 rounds of each side depending on their ability. Sitting postures included Vakra Asana, seated spiral twist, Paschimottanasana Asana, posterior stretch done by bending forward from sitting with hands clasping extended feet, and Purvatana Asana, anterior stretch from sitting with arms behind the back and feet extended forward. All of these were done with breath-body synchronization, and the extent of the effort in the practice was determined by the ability of the individual. The key element was to make their best effort but not focus on trying to be perfect in the postures. Breath awareness was done in each session, and pranayamas, energy-enhancing breathing techniques, including Nadi Shari, alternate nostril breathing, Vagara pranayama, slow deep breathing done on all fours with gentle spinal extension and flexion, and pranayama, deep breathing with production of audible sounds of ah, oo, ah, and om on the exhaled, prolonged exhalation. Each session ended with relaxation for 10 minutes in the supine shavasana, with mindful relaxation of the body parts from toes to the top of the head. However, a core practice of yoga used for all patients in the active group is generally similar but had some adaptations suitable for the individual. There are some studies which involve only a particular type of yoga, like the study on the effectiveness of Kirtan Kriya in depressive disorders among the caregivers of dementia patients, the study on the influence of Iyengar yoga and depressive symptoms among young adults, a study on the effectiveness of Sudarshan Kriya yoga in melancholic depression, a critical role review of the role of Hatha yoga in depression, the effects of Saraj yoga and Shavasana in MDD, respectively. Similarly, study on the effect of laughter yoga and serum cortisol levels, and the role of Kundalini yoga as an adjunct treatment in depression and anxiety in Indian studies. Our study is unique in personalizing the type of yoga therapy tailored to the individual's requirements, and not specializing a single type of yoga as being done in other similar studies. Our study was more focused on the change in the psychopathology of the individuals and was rated with the MADRS, HADS, and CGI scale. In our study, in addition to the MADRS and HADS, the CGI scale was also applied at baseline and at the 30th day to assess the clinical change in the individuals with adjunct yoga therapy. The time spent by the therapist with the yoga group was clearly more than the other groups, and this is the confounding variable possibly, though unlikely in view of the previous studies and observations, which has pointed to the benefits of yoga over placebo. Responsible for the benefits. In addition, we did not anticipate this while designing this study. Furthermore, we do not have a strict yoga protocol for depression, and thus there is a lack of standardization of the treatment received in the yoga group. Conclusion. In our randomized control study to find the effect of adjunctive yoga therapy in the treatment of depressive disorders, we found that the individuals in the yoga group had a significantly higher fall in depression and anxiety scores compared to the control group. They also showed a significant clinical improvement based on the CGI compared to the controlled group at 30th day. It implies that long-term yoga therapy is likely to be beneficial in the treatment of depression, while comorbid anxiety starts to improve with shorter sessions. However, these results need to be interpreted with caution in view of the short follow-up period, lack of blinding, and a small sample size. Further research is needed to study the effect of adjunctive yoga therapy in the outcome of depressive disorders with a larger sample and longer follow-up. Financial support and sponsorship. National Library of Medicine. There were no conflicts of interest. Acknowledgement. They thank Dr. G. Uzumali, the senior statistician at the Mahatma Gandhi Medical College and Research Institute, for his help in the statistical analysis.